Clean needling technique. Hepatitis A. Hepatitis A is mostly due to poor sanitation and overcrowding. The incubation period is 15 to 50 days. The average is 28 days. Hepatitis A has an abrupt onset with high fever. It is most common in children and young adults. Hepatitis A peaks in the fall. The signs and symptoms are abdominal discomfort, loss of appetite, fatigue, nausea, dark urine, and jaundice. The signs and symptoms last for less than 2 months. Once you have had hepatitis A, you cannot be reinfected. The symptoms are relatively mild and not chronic. There is a hepatitis A vaccine available. Hepatitis B, HBV. Hepatitis B is blood-borne. It is the most serious blood-borne virus threatening healthcare workers. Hepatitis B vaccine is strongly recommended for healthcare workers. Hepatitis B incubation period is 50 to 180 days. Hepatitis B is contagious during this period. Hepatitis B is asymptomatic during its contagious period. Hepatitis B begins like a flu or with mild flu-like symptoms, with fever, malaise, anorexia, abdominal pain. Signs and symptoms are chills, nausea, joint pain, rash, and diarrhea. Infected people can also be asymptomatic. Children are oftentimes asymptomatic. 2 to 6 weeks after infection, there is a period of extreme fatigue and depression that can last for several months. 70% of people who recover from the symptomatic stage are still infectious for 3 months or more after symptoms have subsided. 6% of people infected with Hep B become lifelong carriers and may develop cirrhosis of the liver or liver cancer. Of the chronic carriers, 15 to 25% have liver disease. There is no biomedical treatment for hepatitis B. 3 injections of HBV vaccination is available and lasts for over 20 years. If there has been exposure to HBV, an injection of HBIG is immediately given. Hepatitis C, HCV. Hepatitis C is transmitted by exposure to contaminated blood, most common in adults, most prevalent in IV drug users, also in blood transfusions. The incubation period is 20 to 90 days, most commonly 5 to 10 weeks after exposure. Can be transmitted 1 week after exposure to chronic stage. Hepatitis C has an insidious onset with anorexia, nausea, vomiting, and jaundice. 75 to 85% of those infected will develop a chronic infection. 60 to 70% will develop chronic hepatitis and may progress to cirrhosis and cancer. The treatment is interferon and ribavirin for 24 weeks to 2 years. Hepatitis D, HDV, also known as delta hepatitis, requires a concurrent infection with HBV for development. Hepatitis D is mostly seen in IV drug users or hemophiliacs. Hepatitis B vaccination will also protect against hepatitis D. Hep E